Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. I am Farah Haaniya Nuriswarin, and I'm a medical student in Faculty of Medicine and Health Sciences, Islamic State University of Maulana Malik Ibrahim Malang. And now I would like to talk about filariasis. What is filariasis? Okay, filariasis is a tropical disease caused by infestation of filarial worms. There are three main species of filarial worms that can infect the human body. The first is Filariasis pangrafti, the second is Brucia malayi, and the third is Brucia timeri. And all these three species are transmitted by mosquitoes. Filariasis pangrafti are transmitted by Anopheles species, Brucia malayi are transmitted by Monocynia species, and Brucia timeri are transmitted by Anopheles barbarostris. And all the filarial worms are nocturnal. It means that they are active at night. So because of that, the best time to take the blood for the diagnosis is at night, specifically at 10 p.m. until 2 a.m. Okay, and all the filarial worms' habitats are lymphatics. So because of that, the disease is called lymphatic filariasis. And then the next is risk factors. As I said before, that the worms are transmitted by the mosquitoes. So the risk factors are exposure to mosquitoes for a long time, getting bitten by mosquitoes multiple times, people living for a long time in tropical or subtropical areas, people who used to hunt or fish, and the last is warm temperature and sweating that can increase the risk of getting bitten by mosquitoes. The next is the life cycle. There are two stages, mosquito stages and human stages. When there is a L3 larva in the mosquito, and then the mosquito bites the human body through the skin, the larva can infest to the human body through the skin, and then they enter the bloodstream, and then they enter the lymphatics. And the lymphatics, they become adults, and the adults, the males adults and the female adults, they do the copulation, and then they produce eggs and also microfilary that can migrate into lymphatic and peripheral blood circulation. And the blood circulation, there is microfilary that can be taken to determine the diagnosis of this disease. This is called a diagnostic stage. And as I said before, that the best time to take the blood is at night, specifically at 10 p.m. until 2 a.m. because they are active at night or they are nocturnal. Okay, the next, when there is a microfilary in the blood circulation, and then there is a mosquito bites the human body again, the microfilary can enter the mosquito's body throughout the proboscis. Then after that, the microfilary penetrate mosquito's midgut and then migrate to thoracic muscles. And the thoracic muscles, they become L1 larva. That after that grows become L3 larva. After that, they migrate to mosquito head and proboscis. And the proboscis, after if they are being L3 larva, the mosquito bites the human again. After that, the larva enters the human body again. This cycle is repeated in one person to another person. It repeats again, and again. So it is the transmission of the filarial worms. Okay, the next is clinical features. After being infected by the larva of the worms, the human bodies can, the human responses can be symptomatic or asymptomatic, and in the most cases are asymptomatic. And I would like to talk about symptomatic first. In the symptomatics, they can develop into amicrophiloramia after several months that can develop into lymphangitis and lymphadenitis. When they are getting lymphangitis and lymphadenitis, they can also get fever or feverish. And then after 1 year, they can develop into lymphedema, hydrocele, and also funiculitis. And after several years or in chronic stage, they can develop into elephantiasis that getting bigger and bigger again. And then the asymptomatic that occurs in most cases, it develops in the microphiloramia. They don't feel the symptoms. They cannot feel that there is a parasite in their body, but after 1 year or many years, they can feel the acute symptomatic. Just like the symptomatic, they can feel the lymphangitis and then lymphadenitis, and then that can develop into lymphedema, hydrocele, and funiculitis, and then for after several years, they can develop into elephantiasis. Okay, the next, this is the picture of that. Like I said before, the first stage, in the early stage, they don't really feel it, and then it's getting bigger, and this is bigger again. This is in the chronic stage, or it is called elephantiasis. Okay, this is also can occur in the females that can develop in the breast, and then in the males it can develop in the scrotum, or it's called hydrocele. And then this is elephantiasis, like I said before, that it is the complication or chronic stage. Okay, and then the next is the histopathology findings. As I said at the beginning, that there are 3 main species of filarial worms that can infect the human body: Filariasis bancrofti, Brugia malayi, and Brugia timori. All the morphologies of the 3 species are similar, but we can see the difference. Okay, we can see this is the cephalic space, or this is head, this is body that contains the nuclei, and this is the tail. This is the head, this is the body that contains the nuclei, and this is the tail. This is the head, this is the body that contains nuclei, and this is the tail. Okay, and the difference is in the head. In the head, there is a space that contains no nuclei at all. So we can see in the head, this is called cephalic space. Okay, and in the 3 species, the cephalic space we can distinguish from these 3 is the ratio of the cephalic space. We can see this is we can see the diameter and also the length. Okay. In Filariasis bancrofti, the ratio is 1:1. And then in the Brugia malayi, the ratio is 1:2. And in Brugia timori, the ratio is 1:3. So in the Filariasis bancrofti 1, in Brugia malayi 2, and Brugia timori 3, 1:3. This is the difference that can seen in the morphology. Okay, thank you so much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.